everyone, and hello to our panel. So we're here today on Wurundjeri country to talk about policy, practice and communities, and a really big part of this conversation, which we've already started to have, which is great, is around alcohol. It's part of our lives, whether we want it or not. It's everywhere. A lot of us really enjoy it, but we also know that it drives significant harm in our community. We see it in our treatment services, we see it in our family violence statistics, we see it in cancers, liver disease statistics, so it touches everyone, which reminds me that if for whatever reason it touches you a little bit too much right now in this moment, we've got staff from APSU. I don't know if there are any in the room right now, but if you want to touch base. Oh, there's one up the back. Friendly faces everywhere. So feel free to reach out, and also at the break as well. So like with any drug, alcohol policy can reduce harms, but it can also cause them. And what we sort of always strive to do with policy is get policy that reduces harms, but it needs the right social and political support. That's not always easy. So today we'll be talking about how we get there and what we do with it. But what is alcohol policy? That's the thing that you would ask at the start of an essay, isn't it? Well, it's about who buys it, who sells it, who drinks it, how it's done safely. It's all of that, and the rules, the laws, the vibe. It's Marbo, it's everything, it's guidelines. But it's complex to make, so we get there by community activism, like we've heard today about public intox. We get it sometimes through commercial lobbying. We get it through advocacy, regulatory frameworks, economic policies, crisis, like Paul was mentioning. And then we've got the whole thing about jurisdictions. So who does what? We've got the states who do, who can sell it, to whom and where, and Chris is going to take us through that in a minute. And then we've got the feds who do alcohol, what can go into it, labelling, taxation, advertising laws and stuff. So you can imagine it gets to be a bit of a hot potato sometimes. But that doesn't mean that things have to stay the same, that the buck gets passed all the time. We've had a lot of change. We've had the public intox reforms that we've been talking about. And thank you to Nguala Co-Health and Vaz for those insights. That was just a beautiful discussion. Thank you very much, guys. And then we've also got minimum unit pricing. If people heard about that, I was in the Northern Territory, got rolled back recently, even though it was quite successful. And then there's the stuff that sort of is in the grey area of policy, like industry-wise. We've got every phone now is a bottle shop. And that's a really big policy challenge for us all. So what do we do with it? Like, all of us here in some way or another are AOD workers, and we're big on drug policy. We think a lot about legalisation. We think a lot about decriminalisation. But I don't think there's a lot of us who have a really good take or feel really comfortable in thinking about alcohol policy, because we know there are harms, but we don't know what policies make the biggest difference. And also there's this spectre of paternalism sort of hanging around, how far do we want to engage in it? So it's a bit of a weird space for us all to be in. So I'm really pleased that we have this fantastic panel to help us navigate some of this stuff. Dr. Francis Acquah, he is an Executive Director of the Positive Wellness Recovery Centre. He's got 35 years experience in mental health. He co-founded Project Sunrise for African Australian youth, got some woos, and among many other things. His focus is on culturally responsive care, and he is so important for this discussion. Welcome. Clare Davies, pillar of the AOD community, CEO of SHARC, 25 years experience in peer leadership, qualifications in social work, psychology. I can't call this whole race for you, but Harvard Fellow, Vardo board member, where would we be without her? Sarah Callinan, a Principal Research Fellow at Acquah, which is the best name ever. It is a Centre for Alcohol Policy and Research at La Trobe. And Sarah has done a lot of work on pricing, home delivery of alcohol, and has informed an incredible amount of policy change here and overseas. And a regulator who can talk to normal people, we have Chris Carter, Chief Operating Officer of Liquor Control Victoria. Chris joined Victoria's liquor regulating body in 2022, but he brings really interesting regulatory and exec experience from the Financial Services Authority in Vancouver. So, you know, what a panel. Thank you, everybody. It was a quick peremptory clap. So, Chris, we don't know what alcohol regulation is. Can you give us a quick cook's tour of how it works in Victoria?
Yeah, absolutely. So I guess first and foremost, thanks Amy and thanks Vada for the invitation to join today's panel session. I think this is the first time there's been perfect, thank you. First time that a liquor regulator's participated in, so go easy on your reviews, and I'll certainly aspire to speaking in plain language. That's not easy for me, so just be kind as well. I guess I had the opportunity to take a bit of a wander around the exhibitors hall a bit earlier, and I also had the opportunity to listen in on that previous session, and I just have to say I've got an awful lot to learn in this particular space, and the reason I say that is because I think that there is more broadly an opportunity for regulation and frontline service delivery to share more information and to think about how it acts and thinks and works together to achieve harm reduction. Harm reduction is everyone's business, and so this is a tough act to follow after the previous session, and I just wanted to say I think a tremendous amount that I need to learn in this particular space. So I'll start with a little bit about LCV. So first of all, we're Liquor Control Victoria. We're new. First and foremost, we're new. We've been around for about 3 years, and that's despite the fact that liquor regulation has been around for decades, if not millennia. And that gives us the opportunity to do things differently and to try different things and to test different ideas. Secondly, we spoke a little bit earlier, and the theme of the conference is alcohol policy. As the regulator, we don't create the policy and we don't create the law. That's government's job. We administer it. When I say administer it, that sounds very cold and mechanical and passive. I prefer to think of it as we bring it to life. We figure out how it applies in real world settings and real world application. And thirdly, and frankly it's the reason that I'm sitting here today, is because we are looking to do things differently as the regulator. And I guess fundamentally the way that I'm thinking about it is frontline service providers deal with the harm when it's a problem. We as the regulator have the opportunity to be able to move a bit further upstream and to hopefully prevent it's not going to be all, some of that harm from reaching your doorstep. So I think there's just really an opportunity to work together and to be more effective collectively. So onto the slides. I thought I'd just give you a couple of slides in terms of more particularly what we do, and I may have just turned that off potentially. There we go. Okay, so in really simple terms, what do we actually do? Well, someone applies for a license, we assess it, and we give it to them if they're suitable, and we don't if they're not. We do compliance activities, so that's proactive. So in other words, we have inspectors out there 24/7, 365 days of the week, actively looking for problems and making sure that industry is complying with the law. And we also do what I'll call kind of passive or reactive work. So that's we receive complaints, we investigate. Enforcement action, so that can take the form of fines, that can take the form of prosecutions, that can take the form of we seize liquor and destroy liquor, that can take the form of cancelling or suspending liquor licenses. And education and training activities. So you might be aware of responsible service of alcohol training. We administer that training program. 23,000 licensees in Victoria. That's more than New South Wales. Basically, wherever you can buy liquor, we've given them a license. So hotels, bottle shops, wineries, nightclubs, restaurants, cafes, clubs, and events. So that ranges from the Grand Prix to the Laneway Festival to local community events and fetes. And so, for example, footy finals, for example, we give a license for annual community footy finals celebrations. The numbers change a bit over the course of the year, but basically it's a 50-50 split, or maybe 45-55. So you'll see the licensees that are in and around kind of metro Melbourne, Greater Melbourne, and then those that are in the region. So it's a kind of a 50-50 split, more or less. Okay, where do we fit? What we acknowledge is that we're part of an integrated and a very complex system, and frankly, we try to think and act in that way. And as I was saying before, harm reduction's in everyone's business. The world, I think, is more complex and interconnected than it's ever been. You tug something here and something moves over here. So I just don't think we can be effective unless we're part of an integrated system, thinking like an integrated system and seeing as much of the elephant as we can, so we can be effective with our interventions. What do we stand for? So harm reduction sits at the heart of everything that we do. That's the foundational pillar of our legislation. One of the journeys that we have been on over the past couple of years is government has told us that we were always focused on harm in and around a venue. So this is your nightclub, your pub, behaviours in and around the venue, reducing harm in and around a venue. Government said that we want you to focus more on harms in the community. As soon as you start talking about harms in the community, what that does is that shifts your focus from not only venues, but also packaged liquor. And then more particularly,
you mean like bottle shops?
Bottle shops, sorry.
Uninitiated.
I told you I was trying to speak in plain language, but I might not succeed. And home delivery, and I think we'll probably talk a bit more about home delivery a bit later on. But that's the journey that we've been on, and we're trying to do more work with lived experience. So we're doing some work with SHARC on that particular space, and we're also need to do a much better job of accessing non-English background speaking communities. We just need to do better in that particular space. One thing I will also mention is within our legislation, the foundation is harm reduction, but we also do have an objective, a purpose to support a diverse liquor industry. And I think that's a part of the law, and what that I think reflects is just a recognition of the fact that the hospitality industry as an economic driver is enormous. It creates jobs. It attracts tourists. It's part of the entire branding of Melbourne as the cultural, Australia's cultural capital. So I guess my pitch today is we can move upstream, and I think there's opportunities for us to work more closely together. We can't work more closely together unless you know who I am, so here I am. And I'm really looking forward to building relationships, and I'm looking forward to understanding what your ideas are for better regulation in terms of how I can execute on my program. And I have a sneaking suspicion that you know where the problematic venues are. I have a sneaking suspicion that you know where the problematic localities are, and know what the problematic modes of supply are. So I want to build a relationship with a view to better enabling me to do my job further upstream.
Great, thank you, Chris. That's great to hear, an open door from government and the regulator. Interesting to think about your role and, thinking about not only understanding where harm is, but thinking about what you do in relation to harm. And of course, harm is going to be, the way every community experiences harm is going to be really different. Depends on your baseline, your culture, there's a lot of different stuff. So Dr. Acquah, I'm hoping you can help us understand a little bit more about the way you think about harm, having worked in communities, culturally and linguistically diverse communities, particularly with African Australian youth. Is there a different way that we need to be thinking about harm in our community caused by alcohol?
Well, I'm trying to keep to my notes. Otherwise, you'll be here all day. But it's great that Chris has given some of the outlines of how the system works. But I'm going to concentrate a little bit more, even though I prefer to say I support the non-English speaking background people, give some examples around the African culture and your understanding of that. Did you know that if a child is born, on the 7th day, the child gets named? Now, my tongue twister name is Nilante, so I'll be testing you at the end of the day. But on the 7th day, when the child is being named, guess what you get given? Come on.
It's not whiskey, is it?
Of course, it's alcohol. It's actually schnapp. And when you taste that schnapp, you will remember the name for the rest of your life. So that's where you start with the alcohol. It's even right at birth. That's what we use. So at birth, wedding, christening, any function. I've been listening to Jacinta Ardern's book. Any function, such as our greeting to country, you greet with alcohol. If the king is coming to town, if the chief is coming to town, you bring alcohol. In the space of death, you have to bring alcohol to the house. And I don't mean just beer. You have to bring the strong one, schnapp. In fact, it's still made in Holland. We use the aromatic schnapp from Holland in the green bottle. Unfortunately, I wasn't in the office yesterday. I was going to bring one. I do have one in my office. So that's the culture we live with. So right from birth, you get introduced to alcohol. But we also have taboos around these things. Even though I grew up from a house where we have a pub right opposite our house, we never go and sit in the pub to drink. We do it culturally safe that even if we have to do a function, we bring it to the house. Sadly, we've changed a lot of these things. We talked about freedom of speech, but freedom of doing everything. Well, I have been around for a long time, and I know Footscray 30 years ago. And Footscray now, it's a no-go area. It's so filthy, sorry, people living in Footscray, but it's now deteriorated to a state. An example is we were called into an area in St. Alban, the Errington Reserve. There were a group of Africans hanging around, drinking from, 9 a.m. to midnight. It took us 4 to 5 months to get the people's real names. I think my friends from the Aboriginal group has left, but when we talked about the assertive outreach, we had to learn how to sit down and drink with them, eat with them, before they started giving us their names, the real names, and the real telephone numbers. So how do we engage with the people? Sadly, that's what's happening, the change. Africa is only 54 different countries. So that's another aspect that we deal with. So the people from the Horn of Africa, Ethiopians, Somalians, majority of them are Muslims. So they don't drink, but they use other things. We will not talk about that today. But our latest arrival are the South Sudanese, and they are Christians, or majority of them are. So what happens to them is when their young people came here, we opened the door of alcohol. And now that's us coming, and that's where the harm is coming in. The issues around some of these as well are our educational system, which falls in. People have qualifications, and therefore they're not allowed to use them because they're not accepting them here. I give placements for students, and people sometimes they've got PhD, but they can't even find a job because they don't have experience in Australia. And that puts them back into the system of, what do I do? The people in, for example, the Errington Reserve, we discovered there are people who are qualified, people who have houses to go to. Some of them are couch surfing, but the fact is they don't have a job. What do? They come in to socialize. What's easy to socialize with? When you're drunk. Similar to what has been touched on, therefore they get into trouble. And then they get into the justice system, and it becomes a revolving door. One of the examples, we've been working with the NJC, it's what's it stand for? Neighborhood Justice Center.
Yeah.
We've been working with them. One person was referred, and guess what? She referred 14 other people. I'll touch on our relationship, what the Project Sunrise is doing in my next question. So I won't go too much into those details. But we are also trying to collaborate with other groups, such as Co-Health. Like I said, Footscray, we need to go and put a bomb through there. Sorry, Donald Trump. But we need to do something different. We need to, how do we engage with those people to prevent those harm? The harm starts when they are overusing drugs, overusing alcohol without purpose, and therefore they lose their purpose in life. I could go on for a little bit more.
I've been told I have to keep time.
Keep time.
But that's absolutely fascinating, because I think what the point around, the diversity and the difference in the stresses that brings us to a place where, we may be drinking more than we need to is really important, in also thinking about how to respond to the harm and, and how to kind of prevent and get at some of those stresses. And I really like what you say, Dr. Acquah, about the diversity of communities, even within the African community. And it made me think about how our lived experience, people who struggle with alcohol, they're also a really, that's a big country with lots of diversity within it. And what a segue, Clare.
Amazing segues, amazing segues.
So thinking about the diversity, there's a huge amount of people that we're thinking about when I ask you to talk about lived experience, so forgive me for that. But I'm thinking about how we go about making policy when there's so many different people grappling with alcohol addiction in an increasingly digital world. Both of those things all around us, everybody needing a slightly different approach. Can you tell us a little bit, is there something that binds the kind of, the way people experience harm from alcohol and the pressures of kind of managing addiction in the modern context?
I'll be able to answer that in the 3 minutes.
Excellent, yeah.
No problem whatsoever. I just first of all wanted to say thank you to VADA for putting this particular panel on and putting a bit of a spotlight on alcohol, and particularly alcohol policy, given I know it's probably everyone's here, treatment services, this is the drug that is of concern for most people that show up for services. It's definitely the drug that impacts the folks that are a part of the SHARC community the most by far, both people that are having problems with alcohol as well as their families and loved ones. So I think the thing that's, for me, one of the biggest issues in this space is the fact that we still have policy that's really directed at individuals taking responsibility for themselves. So we still have a real emphasis on, people just need to get better educated. People just need to be more aware. All that, ridiculous conversation about people taking personal responsibility. If that was going to work, it would have worked a really long time ago. And there's been absolutely no change to any of our systems related to alcohol for a really long time. So it is, well beyond time to take a look at the system and see what that has to do to make actual, harm reduction a real thing. So like you were saying, the lived experience space is incredibly diverse. And if you put a group of us in a room, which is likely everyone in this room to some extent, you put us in a room, we're going to have really diverse opinions, often born from the experiences that we've had supporting people that we love or actually being that person ourselves. And that is generally the first thing that comes into the conversation. I know at SHARC we've supported people with the ramifications of the lack of regulation around online delivery and marketing and advertising for quite some time. Unfortunately, SHARC is the home for people where we have, serious adverse life incidents We support a lot of families, particularly who have loved ones that have died as a result of the lack of regulation in this area. We've had for a really long time a group at SHARC called the Supper Club that is for people that are bereaved from either overdose of drugs or that have died because of alcohol. That's been going for a really long time. Bit of a plug for Fran and the crew that runs Supper Club. And we've been invited recently to, work with liquor regulation, like my friend Chris was saying, whose first time here. That's amazing. To get the input from lived experience into what liquor regulation should be looking at. And I have some of those thoughts with me that I'd like to share with you that's come out of that space. And these are, I think the thing that works really beautifully with lived experience is we come together generally with really diverse opinions, like what I was saying, born from the adverse events that have happened to us. If you sit us in a room for long enough, we do tend to lean into our values and our principles, which are generally around respect, honouring, people's unique experiences, and we find a way through the middle that recognises everyone's experience, and that for me is always the way through everything. You get the crew together, you sit us down, and we sit there and we wait and we talk and we work it through until we get something that we can work with. So one of the big things that I wanted to speak to that group has found and is real for the rest of our community is the stuff around same-day delivery volume limits. So we do think that there should be volume control associated with the amount of alcohol that is distributed via, I know you know all the, I don't even know the names of them, like through Uber Eats and all the various apps. There's so many of them, right? And they've all got deals for joining. And another big thing for us was unattended deliveries. I didn't actually even know that happened, but people get alcohol delivered, left at the door, like the food that I order food through Uber Eats and I go and get it and it's cold because no one's informed me on the app that the food's not there. But the same thing happens with liquor. And I usually send out my 9-year-old son to get my food. So I'm assuming that's the same that happens with people that are, getting liquor brought home as well. There's a huge amount of work that's been done by our community around density of liquor licences in any area, which I think is that picture that you saw up there before with the blue and the red. And we think that online delivery should be included in the calculation of outlet density in a geographic area, and it should be known to be a risk factor. I mean, it seems so obvious, doesn't it, when you say it out loud? And the other thing is that also related to density of liquor licences is that alcohol companies be required to report delivery data by geographic area to regulators. Nods, I love that.
I love data.
Yeah. We are a community of people that are constantly dealing with grief and loss, and it's associated with poor policy. And like I was saying, there is a way through to hear everyone, and I think it's really important that we do hear everyone and, move towards a society that brings all the views together. They're all valid and finding a way through the middle that actually makes us better people. I think I'm breaking into the next lot of answers.
All right, I'll stop you there, Claire.
Did I go for longer than 5? It's hard, isn't it?
You're good.
It's really hard. Okay.
You're good. I think that's a really, so the question is what's different about the modern world? Yeah, sure, there's all these other techniques, but the answers are probably the same and they're about listening to each other. And it's so interesting that you brought up accessibility because I'm going to ask Sarah a question about it. So, Sarah, you've published really widely, as I mentioned, on alcohol accessibility and harms. And one of the things that interests me around accessibility is a lot of the policy recommendations that come around accessibility. There's some of the stuff that Claire mentioned, but there's also things like, okay, let's create a minimum, like a floor price, minimum unit pricing. Let's restrict online sale and delivery. But a lot of, some people criticise those policies for being overly paternalistic and kind of, controlling kind of access in a really, like in an overly rigorous way. And people raise issues around, human rights issues around low-income people who drink and, making alcohol unaffordable. So as a researcher, I imagine that's a really difficult space to navigate. What do you think about that kind of charge of paternalism in alcohol policy, and how do you go around stepping around the space?
Well, I think first of all, we can't step around it. I think it's an important thing that we should always be considering. And I think one of the things that really struck me listening to the excellent presentations that have been here since morning tea is that there is something to be said for policies that are applied per drink instead of per drinker. Because I think what we've seen a lot of today are examples of how sometimes when a policy is applied per drinker, it's applied in a way that exacerbates existing prejudices and systemic biases and so on, and when at least it's applied per drink, there is less of that, but that could also be seen as quite glib, because obviously the impact of something like a minimum price is going to be felt more by people in low income groups. But we've done some research that's shown that, and what I'm about to say, it seems really obvious, but I think it's an important point. The people that are most affected by a more expensive per drink price are the people who buy and consume the most alcohol, and that they are the ones who are most squarely targeted by a policy like that. And we did sort of check and see, who's impacted more, heavy drinkers or low income drinkers, and it's very clearly heavy drinkers. But there is still obviously more impact amongst low-income drinkers, even if you control for the amount you drink. And that, I think, is where you get into a slightly more maybe philosophical kind of area and a bit less evidence-based. But what we do know from the evidence side is that per drink, low-income drinkers experience more harms than high-income drinkers. And it's not just those social harms that you might think we're talking about here, like the ones about environment. It can't be controlled by the pattern of drinking, and it's for like the really medical harms, like cirrhosis and things, where you think it was just the amount of alcohol you consumed would dictate your harms. But unfortunately, those harms are still more likely to be experienced by people in low income or low socioeconomic groups. And so I think if we are trying to target harms squarely, then policies like that can be really effective. But I also think, at a certain point, from a researcher perspective, we can provide the evidence, but then it also probably does need to be a discussion about, how we want to go about this and a weighing up of those issues that maybe the statistics, that I focus on can't answer as well. And I think I was kind of embarrassed that the thing I nodded the most at was a call for data, because I feel like I'm living up to a real cliche there, because that's where, that's probably where my area of knowledge sort of ends. But so I don't think we should step around these issues. I think we should be constantly discussing them and weighing up the pros and cons, because this is a group of people who are harmed more outside of consumption, outside of drinking patterns, outside of everything. So on one hand, targeting them is great, and especially with increasing health inequality and so on, but being aware that that's what we're doing, and maybe being open and having an open discussion about what's happening, and if we think that is worth it, is probably really important.
Thanks, Sarah. Really wise observations, and I'm reminded of a statistic from the minimum unit pricing. Introduction of minimum unit pricing in the NT. Within the first year, there was a reduction in admissions for chronic liver disease in that first year, which is just mind-blowing, really. So I'm just hoping we can get to a couple of audience questions, but I wanted to ask one to the panel generally. And I think I'd like to talk about, and I'm sure everyone's familiar with the recent coronial report into the really tragic death of a 30-year-old woman, Kathleen Arnold, who lived not that far away in Heidelberg. And she passed away in 2023 as a result of acute alcohol toxicity, and it was like in the context of some pretty chronic alcohol consumption. And we saw the coroner, Ingrid Giles, call for the introduction of a minimum 2-hour delay in online delivery of alcohol, which was, Claire's touched on, and also introducing a restriction on the sale of online sale of alcohol between 10 a.m. and 10 p.m. So there are a couple of like pretty targeted policies. Panel members, I'm hoping you can each give us like okay, well, if I could choose one thing, it's a horrible thing to ask. Nobody asks, nobody wants to pick a favourite, but maybe pick a thing that's like really resonating with you at the moment around like a really big bang for buck in terms of alcohol harm reduction. And let's start in the order we commenced. Over to you, Chris.
Thank you. So big bang buck.
Just one.
Well, just one. Okay. So again, with the caveat that I don't set the policy and I don't determine what the law is, I think the fact of the matter is the piece of legislation that I administer, which is the Liquor Control Reform Act, is quite rickety. It is old. It has been layers upon layers upon layers. So I think there is potentially an opportunity for a fresh look at that piece of legislation and the law is kind of from a more coherent, outcomes-based perspective, bearing in mind that attitudes towards liquor have changed, and we're just in a changing environment. And I think the entire policy construct of the legislation, there is an opportunity to take a fresh look at the entire thing.
And what about, I know some people argue that what we need is kind of like a public health paramountcy sort of principle introduced over the top. So whenever we're making a decision, we have to think about, okay, well, how's the public health served, rather than what we've got at the moment, which is a little bit of a balance between industry, vital communities, and also harm. Would you, do you see a role potentially for that in a new piece of legislation? I mean, difficult position. You're a bureaucrat and a regulator.
I take those as compliments, by the way.
Absolutely, as a former bureaucrat and regulator.
And I'm also going to pull the ripcord here because I'm getting into dangerous territory. But they're ultimately policy decisions for government in terms of where it sees the balance. I have my own personal perspectives, and perspectives I'm willing to share here. But again, that is the balance is a policy matter for government. We contribute to those conversations as the regulator, and I think the people in this room are in a position to be able to advocate for positions as well, and government balances all those positions, including those of industry. So again, pulling that ripcord.
Okay, fair enough. We'll let you off the hook. Dr. Acquah, what's your big ticket? Is it a program thing or a law thing or a policy? Where do you want to see the biggest change?
You see, he wears so many hats. And today he even has to choose which hat is he going to wear for this function. So I say we are in competition with the big brothers, the big banks with the money. So they can go in and lobby and advocate and things like that. But what about us personally? Well, I went to the Royal Commission on Mental Health and I said the system is broken. Now, this was the same sentence they used when they published their report. The 100 pages and pages, that was what was said. But Francis advocates. And this is why we have Project Sunrise, because Project Sunrise is a combination of Odyssey House with Stefan here, Dr. Stefan, YSAS, and my program is called Positive Wellness Recovery Center and an African organization. But I have been lobbying for many, many years. Usually I go by myself. I don't know if any of you went to the Canberra conference a couple of years ago. I paid for myself to go. We need to continually lobby the politicians. We need to present our reports. That's statistics, lady.
That's what my daughter calls me.
It's producing. The politicians are the ones who are going to make a difference. They are the ones who are going to change the law. Unfortunately, I miss the minister because that's another topic. But we need to be active in our own rights the lived experience people, unless we, part of the community, continue to alert the politicians, because they sit in the Eiffel Tower. How long is Ingrid here for? Sorry, I go for all these things. She was here for just the morning session. Speak. In fact, probably what she spoke about was written for her, not her own thoughts. I'm sorry. I'm just so...
Can't be true. Can't be true.
But we need to make the changes. So each and every one of you can make a difference by sometimes writing to your local MP. Invite them to your function. Let them see the real world. And then when they are making the policies, they can change it. So it's about us making the difference. I belong to so many groups, sometimes I don't know which time, like 11 o'clock the night before, I was talking to somebody in Switzerland about somebody here in Melbourne needing some support. So let's make the difference, let's change things. And my bag is, let's influence the politicians so Chris can do his work.
Yeah.
Thank you.
Yeah, thank you. Okay, so Dr. Callinan, statistics lady, what's your biggest beef?
Can't believe you learned my nickname. I think we did a survey in 2013 on how people bought their alcohol, and around 1% of people were having their alcohol delivered even back then, before these services were available, because they were mail order. You could get mail order wine, and this was a particularly moderate drinking group that very few of them drunk harmfully. And so I think one of the things, and I think stuff like that helps us pinpoint, okay, well, what's changed? Because a lot of the delivery services now are linked with much more harmful drinking and more harm. And I think the big thing is the immediacy and the time. And so I think that the fast delivery, particularly when combined with cheap alcohol, like so for instance your big box sort of liquor stores delivering, I think that's a fundamental shift in the accessibility and availability in alcohol. So it's not even about bringing in new regulation, it's about stopping a large increase in accessibility and availability. And I think that focusing on time, and if possible with the intersection of time and price, would be really worthwhile.
Wonderful, thank you. And Claire?
So I think the 2-hour delay was pretty acceptable for us. We thought that was pretty good. The 10 a.m. to 10 p.m, that's a bit of, we think that doesn't go anywhere near far enough. It doesn't go anywhere near far enough for a window of accessibility. We think it should be a lot smaller than that. I know people at SHARC, we've looked at different models, the Catherine model, other models that are, have worked, not worked, but been in existence, to try and, but we ultimately don't have that answer, but we think that the 10 a.m. to 10 p.m. is just ridiculous. It should be a lot, that window should be a lot smaller.
Thank you all for sharing your expertise. I hope you can stick around, and I'm sure you're open for questions and chats during the break. So yeah, thank you so much, Hannah.